If I classify 200 questions into 3 parts, at first 120 questions will be from the previous topics itself. Ideal timeline, divide it into 2 slots. Okay, first 20 days up to 6th of May, you will have the first 20 days of revision. If you have done only the annotation, then only you can focus on the previous topics and you can cover the whole syllabus in a matter of 9 days. Many of you think that INICET is uncrackable or INICET is not meant for me. But let me assure you that you are mistaken, because you don't know the potential of human brain. It has immense potential. I myself, in the last 20 days of NEET PG preparation, my last GT score was 624, and in my real exam I got 698 marks. That means a jump of over 20 corrects. So if this is possible, why you can't increase your number of corrects to maybe 20, 25 in the INICET exam? Give the INICET exam. अगर सिलेक्शन हो गया तो बल्ले बल्ले, अगर ना भी हो, then you know which points and which subjects you are lacking. You will be in the real life exam hall scenario, give it as a GT, and you will be able to analyze your mistakes and you can implement them in your NEET PG preparation. Let me explain you why May INICET is easier to crack compared to the November INICET nowadays. Because most of the aspirants now are not fully prepared. As you know, NEET PG is in 30th August. So सब लोग prepared होंगे November INICET के लिए. May INICET के लिए उतना लोग prepared नहीं होंगे. And moreover, the interns, those who crack in the first attempt, they have just finished their internship or will be finishing their internship in the May or June. So they are not getting extra time to study with focus. And every year the number of seats increases in every session, so there is more and more scope as more and more number of seats are added into the new aims. Do subscribe to my channel because we are very soon to hit 40k subscribers. Coming to the INICET exam pattern, INICET is a predictable PYT based exam. If I classify 200 questions into 3 parts, at first 120 questions will be from the previous topics itself, and 10 to 15 questions you will get direct repeats from previous 8 years of INICET. So this is a very much predictable exam. 80 questions you will get from new topics, among which 10 will be unattemptable. It is better not to attempt them. If you can't rule out any option, the negative marks is more and you are going to get negative. 20 will be from applied knowledge. You can apply the knowledge from your notes and other information you are having during your props. You can apply it and solve the questions. 50 questions will be from your RR or main notes, which is not there in the previous year topics. Now I have INICET past 10 years topic list and it has a very high strike rate, because in INICET November 2025, 140 questions came common from this list. So the link is given in the description box below and pinned comment section. You can check it. INICET has 50 questions, 45 minutes per set. So you get 54 seconds per question and you are going to have time crunch. INICET has many types of questions. Single best possible answer type of question, that is single option correct. It has multiple option correct questions also, like A, B, C options are given. A and B are correct. A is only correct. A, B, C is correct. A and C are correct. Like that. True false questions are also given. The assertion is true and the reason is the correct explanation. The assertion is true and the reason is not the correct explanation. Assertion is true but the reason is false. Both assertion and reason are false. Like this kind of question. And sequence based questions, like in karyotyping, what is the sequence it is following, और in PCR what is the sequence it is following. So INICET में क्या होता है ना, एक को predominant type of question को किसी बार में ज़्यादा देते हैं. Like in my year, multiple corrects were more. In the next year, reasoning assertion was more. In the INICET November 2023, sequence based questions were more. So 10 to 20 ऐसे क्वेश्चंस मिलेंगे जो कि बहुत ही लॉन्ग स्टेम होंगे, मल्टीपल ऑप्शन करेक्ट हो सकते हैं, ट्रू एंड फॉल्स हो सकता है, रीजनिंग एसेशन हो सकता है एंड सीक्वेंस बेस्ड भी हो सकता है. So you have to be prepared for that kind of questions and you will have to look at the timer. This I tell in my videos that your target number of corrects before the exam, no one can predict that, but this is the consensus. My seniors also told this, and this is the INICET May 2025 corrects versus the AIR. With 160 corrects, you get a top 10 rank. 150 corrects, top 100. 140 corrects, top 1000. After that, just 5 corrects less. 2500. 130 corrects, 4000. Then the clustering happens. 120 corrects, 10,000. And 110 corrects, 28,000 rank. Number of incorrect also matters because here one third is negative. The sweet spot to attempt is between 180 to 197. Attempt 197 questions. If you are aspiring to become the topper, then only attempt 197 questions, or else towards the side of 180 questions, because 10 questions will be unattemptable, like the Barth syndrome that came in our year, or maybe the keynote trial that came in our year. Now 30 days are left for the INICET, so the ideal timeline divide it into two slots. Okay, first 20 days up to 6th of May, you will have the first 20 days of revision. This time revise your notes. If you haven't solved 8 years of INICET previous year questions, then you need to solve it, and also club 3 years of NEET PG PYQs also with that, because there is high possibility of chances that from recent years of NEET PG some questions can come in common. In the last 10 days, divide it into 9 day and the last day. In the 9 days, only do the previous year topics, and on the last day, do the 20th notebook and the bookmark previous year questions. Coming to the INICET marks weightage and how your first revision, how many days to give, it is according to the marks weightage. I have taken average of the 5 years of INICET, and here is the average: 12 questions from anatomy, and you are going to give 2 days. 12 questions from physiology can be covered in 1 day. 10 questions from biochem can be covered in 1 day. Path, pharma, micro can be covered in 5 days. Community medicine, more focus on biostats, can be covered in 1 day. Forensic medicine, half a day it could be covered. IENT, in a single day it could be covered. Medicine, try to cover it by 2 days. Surgery and OBGY, try to cover it by 3 days. Pediatrics can be covered in half day, and the rest all short subjects try to cover it in 2 days. With this you will have 18 days. 1 day the Marrow GT is live, give it as a GT, and 1 day you are having buffer, you can give a GT, or you can keep extra day for revision of your weak subject. To get the PDF, join my Telegram channel and WhatsApp channel. Link is given in the description box below and pinned comment section. The PYQ secret which no one tells. Solve only the previous year questions. Why 8 years? Because 2 questions came in 2024 from 2016, and 2 questions came in 2023 from 2015 AIMS. That means AIMS question bank is cumulative, and they can give questions as backdated as 8 years. So 8 years तुमको करके ही जाना पड़ेगा, and only solve previous year questions from Marrow or Prep Ladder, because the explanation matters. How it is going to matter? Let me show you. Because explanation, if annotation in your main source, that is your primary source, is possible, then try to annotate it. If it is not possible to annotate in your main source, then bookmark that previous year question. Let me explain you what is annotation. Now you can see my pathology notes. Coming to the T helper cell, if IL-12 is secreted by the antigen presenting cell, then Th1 is activated. This has come in INICET 2022, and it secretes IL-2, IL-12 and IFN gamma. This has come in INICET 2022. If T helper 2 is stimulated, it secretes IL-4, which stimulates B cells to secrete IgE. It has come in NEET PG 2020 and INICET 2022. IL-9, it was not present in my notes, but it came in INICET May 2022. So I have marked it and added it extra. Like this, you can see anaphylactoid reaction was not present in my notes, but it came in a previous year question of AIMS. So I had annotated this extra point in my notes. This is called annotation. The advantage of annotation is that your strike rate increases. Like IL-9 was not present in my notes, but I added it. So if it is coming in future, then I am going to get it correct. anaphylactoid reaction was not mentioned. So in future, if it is going to come, my strike rate of my notes is going to increase. And see the representation, you can always see the highlighted points and the years mentioned. If you make it attractive, you will always revise the previous year topics when you are looking at your notes, and you are not going to forget a single previous year topic and the single previous year question. Like this, if you annotate in the last 10 days, as I mentioned that in the last 10 days only do the previous year topics. If you have done only the annotation, then only you can focus on the previous year topics and you can cover the whole syllabus in a matter of 9 days. If annotation is not possible, like this was my bookmark previous year question, the answer was optic nerve sheath meningioma. It was said that where tram track appearance is seen. Now Marrow has explained it beautifully why the tram track appearance is being seen, and it was a recent year NEET PG question also. But with that, they have also given a related pearl where the tram track appearance could be seen. Like in pulmonology, it could be seen in bronchiectasis. Tram track sign is seen in lateral chest X-ray. In nephrology, MPGN type 1. In neurology, tram track is seen in optic nerve sheath glioma and Sturge-Weber syndrome. In mammary glands, it is seen in duct ectasia. That is the whole previous year topic related to the tram track sign is being covered in the explanation. I give you an example of recent year NEET PG topper. In last 50 days, what he didn't study any notes. He only did the previous year question modules and he read throughout the explanation, and he gave 45 GTs and reviewed them all and the explanations with no revision, and he got a top 200 AIR. That means that the previous year questions which you are solving, the explanation is not just a testing tool, but also it is a revision tool which most of us ignore. Only the toppers focus on the explanation because each and every option is a future question. If you read the explanation properly, all your previous year topics are covered. एंड तुम लोगों ने तो देख ही लिया कि 140 क्वेश्चंस केम इन कॉमन फ्रॉम द प्रीवियस ईयर टॉपिक्स ऑफ INICET in INICET November 2025. So follow this PYQ trick which I just disclosed because this no one else is telling. 20th notebook. If you haven't made a 20th notebook, then make a 20th WhatsApp group. Take the photos from your notes which are volatile previous year topics. Only previous year topics keep in your 20th notebook, no other information. And some PYT related pearls also you can bookmark. Custom modules, this is an MCQ based exam. You should throw foreign and novel MCQs to yourself and test it at 9 a.m. when the exam is going to take place. So give the hashtag of recent NEET, hashtag aims, hashtag clinical, hashtag investigation of choice, hashtag drug of choice, hashtag image based, and do a mixed bag of all the subjects, not a single subject. Okay, do a mixed bag of all 19 subjects, then only you will get confidence. Digital image bank, this is important for INICET because as you had seen that my notes were handwritten notes and no images were present, so I made a major mistake. This image was given in my year INICET and the answer was trombiculidmide, but I thought it to be heart rate. This was because I didn't have a digital image bank. So 90% of the image based questions of INICET are from the browser. That's why a digital image bank is going to help you because the notes are also not able to give the classical browser search images due to copyright issues. So if you want to have my digital image bank, then Digital Image Bank Pro has 1850 plus images and all the previous year questions as you can see are annotated, and it contains all the recent year previous year questions also up to FMGE Jan 2026. The link is given in the description box below and pinned comment section, you can check it. Coming to extra topics which are important for the INICET. Actually, I didn't know these are important for the INICET and we have to prepare it from online sources. That's why my rank slipped from 29 to 684 in the INICET, and I don't want you to do the same mistakes. First thing that is important is the recent FDA approved drugs from 2020 to 2026, only the important ones. Type FDA approved drugs and the year you want to search. suppose you want to search 26, so write FDA approved drugs 2026, then open this www.fda.gov.in. Now you can see all the FDA approved drugs which have been approved for 2026. All the drugs you don't need to remember, only the important drugs. Like copper histidine is used to treat Menkes disease. Menkes disease is not having that much good treatment except the gene therapy. So this has a very high probability of being asked. Like this kind of drugs which have very high probability of being asked, study only those drugs. Other thing is parasite life cycles. You can get it in the INICET Essentials Drive link. It is given in the description box below and pinned comment section. And also the monoclonal antibodies. It is also given in the INICET Essentials topic list. You can check it from the description box below and pinned comment section. Now, if you found this video helpful, do consider subscribing. And now, if you are preparing for NEET PG, watch the video on how to prepare for NEET PG starting from now and how is INICET different from NEET PG. All the best for your INICET and upcoming exams.